I said at the beginning, May is many things in this month, but it is Stroke Awareness Month. And here with us today to help spread the word is Dr. Barnhart and a stroke survivor, Shelley Evans. Welcome to both of you, and thank you for being here on the comfy couch today. Shelley, today is May 1st, and it is American Stroke Month. You have a personal journey to share with us, and can you tell us a little bit about your story right off the bat so we understand how important this is?
Sure. I was at work. My coworker, tried to talk to me and I wasn't responding. And she pulled my chair back and said, "Somebody call 911," because I was just like catatonic. And they called 911. I was in Fife, so the Fife, Fife EMTs got there really quick. And they did their thing, got me in the ambulance, took me to Tacoma General. I could kind of hear them.
Here you are.
Oh, yeah.
Yeah, hard to look at, isn't it?
Yeah. I could hear them saying, we have a woman who was having a stroke while we were in the ambulance. So when I got to the hospital, they had the team ready and they did their magic. I have a stent in my head where they took the doctor took the clot out, and they gave me the medicine, and I can't remember what's that called.
That's okay. You don't need to know that, but he does have an answer.
Okay.
He is the doctor.
Yeah.
Yes.
So yeah, and then I was in the ICU for a while, and then I went up to the other floor. I can't remember what it was called, and then and luckily everything worked out perfectly, and I am about 90% good. So it's very important to call 911.
Shelley, what an amazing story. And that coworker, gosh, she saved your life.
Yeah.
Yeah, my goodness. How long ago was this?
In 2023.
Okay, so just 2 years ago.
Yeah, 2 years.
How are you? And you mentioned you've got a stent.
Yes.
Which is a normal part, or that can be a normal part of a stroke. How are you doing today?
I'm doing okay. I have words. Sometimes it's hard to find words.
Yes.
But other than that, I have a job, so I'm doing good.
And today is your daughter's 40th birthday.
Yes,
so it's also your birthday. Boy, that cannot be underscored, just the tenderness and the sacredness of being around to see your daughter's birthday, and for her to say, "My mom is with me today."
Yes.
You are just incredible.
Thank you.
I'm going to give you a break just for a second over there. Dr. Barnhart, Shelley's coworkers called 911 to take her to the hospital. Sometimes someone might think that they could, because Fife is very small, and her coworker could have said, "Hey, I can get you to the hospital, quicker than in my car, than calling an ambulance and waiting." Why is it important to call 911 when a stroke is even suspected?
Well, response times are very quick for EMS. They get there within minutes. And one thing that people don't really recognize is that when the EMS providers call us in the emergency department, we're getting prepared for the patient to arrive.
Yeah.
So at most of the hospitals around Tacoma, we take patients straight to the CAT scan from the EMS rig. So it actually saves time rather than cost time to call the EMS providers.
And Dr. Barnhart, as we were looking at pictures of that trip and someone, being delivered to the hospital, we've learned from Shelley's story that stroke treatments are available. The minute she got into that ambulance, they knew kind of what was going on. What's important for us all to know about stroke treatment because the technology and the symptoms become more and more clear all the time the longer we study them?
It's really pretty simple. The faster you show up to the emergency department, the more options we have for treatment.
Right.
Unfortunately, sometimes we have people who wait, and sometimes overnight. And as we get further away from the onset of symptoms, our options for treatment are fewer and fewer.
Yeah. I mean, I'm looking at Shelley over here, and when you said that, her eyes filled up with tears again because, yeah, waiting overnight. I know people who have waited too long, and it's been debilitating, and they now understand how different their recovery could have been or might have been if they had gone sooner and known. Women are impacted more than their male counterparts. Is that correct, number one, still? And can you share a couple of stroke factors unique to women?
Yeah, stroke factors unique to women. Birth control pills, especially combined with smoking, is a huge risk factor for stroke. And also some of the changes that can occur with pregnancy can increase risk of stroke, like pregnancy-induced hypertension.
And so is it still the standard that women are more at risk than their male counterparts?
To some extent, yes.
Okay, all right. So Shelley, what do you want people to know? If there's one thing they get from our time together today, what do you want them to know?
Just get to the hospital
Right.
as soon as you can.
Dr. Barnhart, in your practice, what is the one thing you wish now in terms of looking at that big picture that you wish people know? And we're showing the signs of a stroke up here.
Yes.
I think that if folks understand these signs of a stroke and also add in their dizziness and vision changes,
Right.
Oh, yes.
because the FAST exam does not include those. But if you're having dizziness or vision changes, in addition to a positive FAST exam, then you should come to the emergency department right away and ideally call 911 to get there.
You had, according to the person who called 911, you just weren't responding. Do you remember any of that at all?
A little bit. It kind of comes and goes, you know, and vision change definitely because I was totally blind.
Okay.
It was weird, but yeah.
The fact that you are here and sharing your story and you are sharing your expertise is invaluable. Thank you so much for your time today.
You're welcome.
And for spreading the word about how we all can look for those signs of stroke and hopefully act when we see them.
Yes.
And time is of the essence. Thank you so much.
Thanks for having us.
Thank you.
My pleasure. We have much more to come on Cityline. Don't go away. We'll be right back.